Hey everybody, we are going to be talking about the fun topic of hepatitis today. And so for a general outline of what we'll be covering, we're going to start with some of the very basics of hepatitis. Then we'll move into the different types. So there's A through E, but we're really going to be focusing on B. Hepatitis B, that is going to be the main player. Then we'll also talk about blood levels and surface antigens and antibodies and all that fun stuff. And that'll kind of go along with B because any test that I've taken, it's been primarily focused on hepatitis B. So this is the high yield stuff about hepatitis. So let's go ahead and move on to the hepatitis basics. Alright, so what does hepatitis mean? Well, breaking its name down, hepatitis, it's going to stand for inflammation. Inflammation of the liver. That's all hepatitis means. So you've got the parenchyma, you've got the liver cells. So symptomology is going to be very vague. So some of the symptoms, we're talking, you may have aches, body aches, you may have lethargy, you may have headaches, you may have pain in your abdomen area. Very, very basic, kind of generalized, non-specific symptoms. I've seen it described as flu-like almost. So think of the symptoms when you have the flu. You're just kind of tired, you ache, you have a headache, you may have generalized pain. So really it's not the symptoms that are going to tip you off. If you clinically suspect hepatitis, then you would try and match as many symptoms as you could to it. But really it's going to be your lab work. And labs, your primary labs that you're going to see, there are others, but it's really going to be your AST and your ALT. So those are your enzymes, they're liver enzymes, they're great markers of what's going on in your liver. So you've got the AST and the ALT. So there's a couple different options you could have. Both of these will be elevated. You're going to have elevated ALT and elevated AST. Now, as a general rule of thumb, if AST is higher than ALT, you're going to think alcoholic hepatitis due to alcohol. So there's a lot of different causes of hepatitis. There's going to be autoimmune, there's going to be chemical, like toxin mediated, and one of those toxins could be alcohol. There's viral. There's tons of different causes. Today's lecture is primarily going to focus on viral, because viral is where the test questions come from. Yes, alcoholic hepatitis can occur. However, it's going to be viral. So if you see an AST ratio greater than ALT, so if the AST is higher, you're going to immediately tip your mind into alcohol. However, if your ALT is greater than AST, pretty much all else is the best way to describe it. So the main one I want you to think about, though, is going to be viral. So, okay, let's move on to viral. Now that we kind of got that out of the way, we got the basics done. We talked about what causes it: viral, autoimmune, toxins, alcohol, general symptoms. But it basically all ends in the same. You have inflammation of the liver. Now you could have an acute infection, meaning you get an acute inflammation, your body takes care of it, and it resolves. That's it. That's an acute hepatitis. You resolve, you have no, assuming your body didn't overreact and the inflammation didn't cause too much damage, you'll have no permanent damage. You can also have chronic, and then also have fulminant. So you don't want these if you had to have a hepatitis. You'd want the acute, because fulminant is going to cause a lot of damage, and chronic can cause a lot of damage. Okay, but let's talk about viral hepatitis, because this is where the money questions are going to come from. Now, I've already kind of alluded to there's going to be 5 types. There's going to be A, there's going to be B, C, D, and E. Pretty simple, right? These are going to be your main categories of hepatitis. Now, there may be others. These are going to be your money questions. This is where the test questions will come from. So let's try and categorize this. A and E. These are going to be two that you get from the fecal-oral route. So your enteral route. I've already kind of covered enteral versus parenteral in a different video. So this is going to be your enteral, which is going to be, fecal-oral. It's going to be your fecal-oral route. And same here. So let's say there's a contaminated water source, contaminated food. Let's say someone who has a hepatitis A infection, if they don't use proper hygiene, they may pass it through their feces and it goes into a river. These are typically going to be in underdeveloped countries or areas of poor sanitation. So that's where you're going to see hepatitis A and E. B, C, and D. Now these are all going to be dealing with something besides the enteral route. These will be parenteral. So for hepatitis B, the main way to transmit this is going to be through like IV, so intravenous, possible drug use, sex, and vertical. Vertical transmission is simply from mom to child, especially during delivery. So IV, sex, and vertical. Now, hepatitis D is going to be the exact same as B. And then hepatitis C, if you ever hear intravenous drug use, you're going to think hepatitis C. It can happen because remember, IV route is drug use as well, B and D. However, the number one transmission is through the blood for hepatitis C. So blood, direct blood contact through used needles, possibly blood transfusions. Blood transfusion, when the laboratory cannot screen it as well, that can happen. So hepatitis C, you're going to think blood. Hepatitis A and E, you're thinking enteral. And hepatitis B and D, you're thinking IV, sex, and vertical transmission. Now, let's also talk a little bit more about their genome. So we talked about their transmission route. Hepatitis A and hepatitis E, these are going to be the enteral route. They'll also be self-limited. You're going to get an acute inflammation that's often subclinical, meaning that their symptoms aren't going to be as bad. So if you had to get a viral hepatitis, you would want hepatitis A. You would want hepatitis E. Why is that? It's self-limited. Eventually, your body will get over it, and you will not be a chronic carrier of hepatitis A virus. You will have the hepatitis A virus for a little bit. Your body takes care of it. It's self-limited. Then you resolve. You no longer have the virus. Same here. It's going to be self-limited. So you'll get over the virus eventually. Your hepatitis, your inflammation eventually goes away. However, hepatitis B, C, and D, these will all be chronic, exclamation mark. I'm trying to write sideways. Hepatitis B, C, and D are all chronic. So once you get infected, there are instances where you can get over it. And we'll talk about that, especially with hepatitis B. You can get the hepatitis B infection. You can have that acute phase. You can have that acute inflammation, hepatitis. But then eventually, you'll get over it. However, these can develop into chronic infections, meaning you'll have it for the rest of your life, most likely. So, hepatitis A and E are self-limited. B, C, and D can be chronic. Let's quickly talk about the types of virus that these are. A is going to be an RNA. These are mostly going to be RNA viruses. C is RNA, D is RNA, E is RNA. What does that leave? Hepatitis B is different. It's going to be DNA. And we're going to be talking about hepatitis B a little bit as well. But just realize that hepatitis B, this is a testable question. Which one is a DNA virus? So they each belong to a different kind of group of families, except for hepatitis D. It's kind of like an unclassified. But hepatitis A, this is going to be a picornavirus. Picornavirus. So what that means is it's going to be a single-stranded RNA virus that's linear, and it's not going to have an envelope. I'm just going to change colors here so it doesn't no envelope. Also notice down here, this one's going to have no envelope. And I'll cover that once we get there. So hepatitis A, picornavirus, no envelope. It's going to be a single-stranded, linear RNA virus. Hepatitis B, on the other hand, is going to be a hepadna virus. Hepadna virus. Now it's going to be a double-stranded DNA virus, meaning there's two strands. It's going to be in a circular form. While this one is linear, this one will be circular, and yes, there will be an envelope. There will be an envelope for C. There will be an envelope for D. I just indicated the ones that don't have envelopes, and you can draw conclusions from the rest. So hepatitis C is going to be a flavivirus. Flavivirus, okay? And then, like I said, class D, the hepatitis D virus, this one's going to be like an unclassified. It'll just be called a delta-like virus, delta virus. And then E will be a hepi virus. Okay, so I said I'd get back to this no envelope business. As a general rule of thumb, now the purists will not like me for saying this, however, as a general rule of thumb, if a virus does not have envelope, let's get rid of this line just so we have it a little nicer. If a virus does not have an envelope, you will acquire it from the environment. Environment. Let's see, does that rule hold true here? Yes, the fecal-oral route. You acquire the A and E virus through parent or enteral means, meaning it's like your fecal-oral route, from the environment. You can get it through direct contact. You can get it through contaminated food. You can get it from contaminated water supplies. Anything in the environment that is contaminated. You don't need the direct blood transfusion. That would be like here. Or sexual fluids. IV use, that's blood. Or vertical, like during delivery, that's blood transmission. Enteral. So as a general rule of thumb, if you see no envelope, you're going to get it from the environment. Okay, so that's some of the basics. Maybe I should cover a little bit more about these. So hepatitis D, you're going to require B for transmission. That is a major high yield test point. Needs B. Hepatitis D needs B. What you're going to need is you're going to need the hepatitis B surface antigen, HBsAg, hepatitis B surface antigen for infection for hepatitis D. So you need to co-infect. So if you have hepatitis B virus, you need to be on the lookout for hepatitis D co-infection. You can't get the hepatitis D infection alone in most circumstances. You can get a super infection, but that's kind of beyond the scope of what I'll talk about today. To co-infect, you need hepatitis B for hepatitis D. Okay, that is an important point that you should know. A little bit more about hepatitis E. If you get it during pregnancy, that's bad. It can lead to the fulminant hepatitis, which is causing massive liver damage. Fulminant. If pregnant. So if in a question prompt you have a female who has been diagnosed with hepatitis due to abnormal liver enzymes, she has an elevated ALT and AST, so she has a suspected hepatitis. Now it also goes on to say that her hepatitis B surface antigen is negative, and I'll cover all that later. All this HB, SAG, HBE, AG, all that fun stuff, I'll cover that in the next slide. However, just realize that if she's negative for the hepatitis B markers, be suspecting hepatitis E, because that can lead to some serious liver damage. Hepatitis B is really common everywhere. There's a lot of people already infected, and you know, I'm just gonna hepatitis B. So hepatitis B, you can get an acute infection. That acute infection, like I said, it can resolve. You no longer have that hepatitis B infection. Because remember here, A and E are self-limited, while B, C, and D can become chronic. So we have that acute infection, and we resolve. Or it can become chronic. That chronic infection, a small percentage, can go on to cirrhosis, to a cirrhotic liver, and that cirrhotic liver can finally lead to hepatocellular carcinoma, which is going to be a cancer. When you hear carcinoma, you want to think bad. So if you have an epithelial cancer, you're going to have a hepatocellular carcinoma. It's due to this hepatitis B infection. It can resolve. It can become chronic. Those that become chronic can have eventually a form of cancer. So yes, it's a small chance. However, hepatitis B infection can develop cancer. Now you can also get that for others as well, but hepatitis B is going to be your main one. But like hepatitis C, for example, can also cause hepatocellular carcinoma. Is that all I want to say? Maybe let's talk about A a little bit. A, it's going to be endemic in Africa. You're going to see it in South America. You're going to see it in maybe Southeast Asia. It is common, and you're going to see a lot of it. So if you have a question prompt that says you have a traveler who comes back from China after a month-long vacation, they complain of soreness, aches, tiredness, the malaise, just generalized feelings of flu-like symptoms. You get a liver enzyme on them. They have elevated ALT-AST ratio. You're going to be thinking hepatitis, and you're going to be thinking hepatitis A, for example. Hepatitis A, you're going to see in daycare settings, in very unsanitary daycare settings. You're also going to see it direct contact, endemic areas. You're going to also see it in raw shellfish. I've been asked a question before. It actually kind of caught me off guard. Raw shellfish. So if you see a shellfish that's caught in a contaminated river, for example, and it's not cleaned and cooked properly, then they may be carrying the hepatitis A virus. So raw shellfish can be a vector of transmission for hepatitis A. Again, especially you can vaccinate against some of these. They have a hepatitis B vaccine, hepatitis A vaccine. The A vaccine is really meant for travelers or the high-risk group in those unsanitary conditions. So travelers to endemic areas would be a good indication for the vaccine. Not everybody gets it. So as I promised, I will talk about hepatitis markers and testing. Now, all that other stuff was good, especially you should know the generalized stuff over here. I kind of talked about some of the buzzwords. If you see fulminant in pregnancy, you're thinking E. Raw shellfish, however specific that is, always be thinking A. Blood, when you hear blood, you want to think C, but also it could be B or D. Co-infection, D needs B. That's some of the high yield stuff. Over here, which one's a DNA virus? B, easy. Which one has an envelope? B, C, and D. These are easy questions that you can get. However, a lot of questions will arise from this area that I'm about to talk about. So we need to quickly cover some of the very basics. You already know this most likely. However, this will be a nice refresher. We need to cover antigen versus antibody, AB. Antigen is just going to be a cell surface marker. And it doesn't need to be a cell surface marker, it just needs to be a marker. Because it could be a core marker, it could be a surface marker, just a marker. So it'll be a marker of the hepatitis B virus. We're going to be talking about hepatitis B today. That's going to be where all the test questions come from, most likely. Then also antibody is going to be an immune response. It's going to be an immunoglobulin. Now, the purists out there are saying, well, you can't really define that. That's going to be my definition. Hopefully by now you know what an antibody is. I do have videos about antibodies. Those B cells and the plasma cells will be secreting out your immunoglobulin. So your immune system makes these immunoglobulins, and those will find the antigens, and you will have fun with that. So that is our housekeeping. Now let's get on to the money questions here. So we've got this virus particle. We've got a viral particle here. Now remember I said hepatitis B has a shell. It is enveloped. Remember I said that the non-envelopes were A and E, but B, C, and D do have envelopes. So we check mark, we do have an envelope. This is going to be your shell, your outer coating, your surface. So hepatitis B, surface antigen. Now let's cover the naming really quick here. H, hepatitis. That will hold true. B. Ooh, that one was tough. S is going to be for surface. Antigen. AG is shorthand for antigen. AB is going to be shorthand for antibody. So AG is antigen. Remember, antigen is just the marker. AB is going to be antibody. So what's going to change? The H is always going to be the same. We're always going to be talking about a hepatitis, of course. The B describes what virus we're talking about, and for our sake, we're going to be talking about the hepatitis B virus. However, you might also see hepatitis A surface antigen, for example. The hepatitis A, it just says what type of the hepatitis we're talking about, and we're going to be talking about B. The S is going to stand for surface. It can also be a little E, and that's just going to be a different marker. It's going to be, it's going to indicate something, and I'll save that for when we get there. Don't want to spoil the surprise yet. It's like opening a present before your birthday. Okay, so S is going to stand for your surface antigen, and then also you can get C as well. You know, I think we should talk about that right now. I don't know why I erased it. So we have S, we have E, and we have C. Now S, I've already said, is going to be your surface antigen. That could be like something, a little antigen marker here on your envelope, the outer surface. Now inside, you're going to have your core of the virus. That core is also going to have some antigen on it. So that will be your C. While this is your S, this is your C. Now, during active replication of this virus, this core protein can change. You're going to have a different expression of another core protein. And that'll be indicated by these white little dots. I know it's hard for a white on white background. However, just realize that during active replication, so C is going to be core. During active replication, you're going to have a change in the variant of that core antigen. And that's going to be your E. Your E. It's still going to be core, except I'm going to put it in quotation marks. This is the money question of the day. This is the one thing I want you to take away from this. It means you're going to have an active infection. It's going to be actively replicating. Actively replicating. Active infection, active replication. Remember that. If you see H, B, E, A, G, hepatitis B, E antigen, AG antigen, E antigen, think active replication, think active infection. Now, this is going to equate to a high infectability. So remember, I'm going to go back here. Oh, too far. Here we go. Hepatitis B can get transmitted through IV, sex, or vertical. Now, if a mother is delivering her child and she is expressing hepatitis B E antigen, it means that this virus is actively replicating. It has a high infectability. That mother has a very high likelihood, therefore, of transmitting this virus to the child via delivery. Or let's say the mother is sexually active. If she is expressing this hepatitis B E antigen, she will have a high chance of sexually transmitting this hepatitis B virus. Remember that. That is an excellent test question. Hepatitis B E antigen, high infectability due to the active replication, due to the active infection of the virus. Okay, that is the one takeaway message that you really should get from this whole lecture. Not just this slide, this whole lecture. Hepatitis B E antigen. Okay, but we still have a lot to go, so bear with me. Buckle your seatbelts. We're going to get through this together. We can do it. So you may have seen a plot like this before, where on the x-axis you're going to see time after exposure or time after infection, however you want to do it. Then over here you're going to see titer levels. So pretty much just level of either the antigen or the antibody in the blood. So you're going to have right here at time 0, you're going to have exposure / infection. You're going to get infected with the hepatitis B virus. Okay, so that's the basics. Now let's draw in a little bit. We've got this marker here, and this is going to be, let's see, I need to make my pen smaller. Hepatitis B surface antigen. So we have hepatitis B surface antigen. What this is going to be is it's going to be an active, it's going to indicate that you have an active infection. Active infection. So you have a hepatitis B surface antigen. Well, does that make sense? Yes. If you see this antigen in the bloodstream, so if you take a sample of patient's blood and you see this antigen right here, meaning hepatitis B surface antigen, it means that there's some hepatitis B virus in the blood. So it makes sense. If you see this in the patient's blood, then it means they'll have an active infection. Now remember, hepatitis B can either go into complete recovery, you get rid of it because you become immune to the virus, or it can go into a chronic infection. But this right now means that we are actively infected. Also, you're going to see hepatitis B, HB, EAG. Remember, we just covered this. This is going to be during your active replication. Your virus is going to be active. You're going to be infective, super infective during this period. So you're going to have high infectivity. It's going to indicate your active replication. You're going to have the virus in your system here, but really it's going to start replicating and so on, and that's going to be the high infectability. You're also going to start producing, your immune system's kind of incompetent during this period, but eventually your immune system catches on and says, uh-oh, I see that hepatitis B coming, we got to do something. So you got to respond. So you're going to produce some anti-hepatitis B. Anti meaning you're going to be making antibodies against hepatitis B core immunoglobulins. Now, an immunoglobulin can either be IgM or it can be IgG. IgM is your immediate response. Immediate response. Now, why do I draw it like that? Your immediate response, you're immediately going to produce IgM. Eventually, later on down the road, you'll isotype switch to IgG. So that's going to be more of like a chronic or long term. I'm just going to write chronic. Just remember that's long term. Immediate is going to be IgM. Long term, you're going to produce isotype switching to IgG antibodies. So you're going to be producing some anti-HBC antibodies. Okay, so we have the C, which is going to stand for core antigen. You're going to have the surface antigen, and you're going to have the E for active replication antigen. Those are our three different types. So HBS antigen is going to be our active infection. HBE antigen, we've already covered, is going to be high infection. It's going to do that active replication. It's going to be high infectivity. We've also got our hepatitis B core antigen. That's just going to be our core marker. So S is surface, C is core. Now, we're also going to have some antibodies produced. Hepatitis B surface antibody. So what this indicates is we're going to have immunity to Hep B in this case, since it's hepatitis B that we're talking about. So if we see a hepatitis B surface antibody and nothing else, it means that we no longer have the hepatitis B infection, and it also means that we'll get to that later. Hepatitis B surface antibody immunity to hepatitis B. If we see a hepatitis B E antibody, it means we have low infectability. If we see a hepatitis B core immunoglobulin G, I might be running out of room. Hepatitis, I might need to write slow. Chronic infection. Okay, so if we see the hepatitis B surface antigen, it means that we have some of that virus still in our system. But we're also producing IgG, which is kind of like our long-term chronic immunoglobulin, to the core antigen. That's going to indicate that we do have a chronic infection present. Then I'll start over here. Hepatitis B core immunoglobulin again, so we'll say IgG. But we also are producing anti-hepatitis B surface antibodies. I probably should have just erased that. It means we have a resolved infection. Okay, so let's finish up our chart over here because I kind of neglected it on a kind of an off tangent. So we're gonna produce some anti-hepatitis B core antibodies. So we're going to produce some anti-hepatitis B, not core, E, antibodies, and we're also going to see some anti-hepatitis B surface antibodies. antibodies. Okay, what does all of this mean? Well, it means as at the initial point of infection, the virus is going to replicate, and then it's going to be high replication, high infectivity by expressing that E antigen. We're also going to express some hepatitis B surface antigen. So the surface antigen just means we have virus present. The E means it's actively replicating. It's high infectivity. Eventually what's going to happen is our body is going to detect this. It's going to detect that core antigen, ramp up its antibody production. It's going to initially produce some IgM and then switch to IgG eventually. The IgM will decrease while the IgG will continue at a high titer level. Now, eventually your body's also going to say, hey, I see this E antigen. Well, let's produce some anti-E antibodies. So some antibodies against E. So that's where this comes in. That's where this titer level comes in. And then eventually your body will say, I see that surface antigen. So you're going to produce some anti-surface antibodies, that anti-surface antigen antibody. So those are the levels. However, now you have infections. So if we look over here, the hepatitis B surface antigen, if you see that in any lab panel that you're given, it means you have an active infection. You see that, so here's your virus, here's that surface, here's the small core proteins that you have. If you see this marker right here, this surface antigen, as indicated by hepatitis B surface antigen, it means you have an active infection. You have this virus in your body. If you have a hepatitis B antigen present, it means that you have the core present as well, and its isotype switched to kind of like an active form of replication, and you're going to have increased infectivity. The hepatitis B core antigen, again, if you see it, you're going to have an active infection. So hepatitis B surface antibody. If you see that hepatitis B surface antibody with nothing else, with no antigen present, means you're going to have immunity to hepatitis B. The next time this hepatitis B with all of its surface markers comes into the body, you already have antibodies against it. So those antibodies will neutralize the virus before it becomes infective. You will no longer have the hepatitis B capacity to get hepatitis B. You will have immunity to it. Hepatitis B antibody. It means that you are making antibodies against that E core surface E antigen. When it can't form that E antigen, it's no longer super infective. You can still get infected. However, if you're making antibodies against that E, all it can have is the C and the S. Every time it switches to an E, your immune system detects it and gets rid of it. So every time it switches to E, which is the high infectability stage, you're going to get rid of it. So thus, you're just going to have low infectivity. If you see the hepatitis B core immunoglobulin, so up here, this one, if you see this, plus you see some surface antigen, it means you're chronically infected. Remember, if you see this hepatitis B surface antigen, you're going to have an infection. But here, you're making antibodies against the core, you're going to have a chronic infection. If you see the exact same thing, except this time with anti-surface antibodies, it means that you originally had this antigen, and you originally had this core protein, but your body is now producing antibodies against both. It means you'll have been infected at one point, but now you resolved. Because remember, you can go from acute to chronic or acute to resolved. This acute to resolved is where you'll see levels of this. So all of this, if you get a lab panel with any of these, just think, am I looking at an antigen or am I looking at an antibody? And then from there, you can say, am I looking at a surface marker or am I looking at a core marker? And if it's that E core marker, then you know you're you'll have an active infection. That is the one take-home message that you should take away from this lecture. You will have a test question on it. So hopefully you found this video useful. If you have any questions, be sure to contact me. It gets a little hairy once we kind of dive into this slide. This slide is a lot harder to explain, especially when you throw it all on one slide. I don't have that much space. If I had a large whiteboard, maybe it would be a little easier. This stuff is difficult to understand. The conceptual nature of this beast is harder than most topics. You know, I might make a new video in the future that tries to explain it a little better. However, this is a good backbone for learning. You know, if you have any questions, be sure to ask. Any comments, I always appreciate comments. Be sure to like and be sure to subscribe for more great videos. Thank you very much.